Welcome. My name is Brenda Scott, and I'm a commissioner with the Riverside County Behavioral Health Commission. The Behavioral Health Commission is an advisory body composed of volunteers appointed by the Board of Supervisors who work in conjunction with the Riverside University Health System Behavioral Health to ensure citizen and professional involvement in all aspects of department services. This video is designed to seek your feedback in behavioral health care in Riverside County. Every year, California counties develop planning documents that identify mental health programs and services to be funded by the Mental Health Services Act, also known as MHSA or MISA, a voter-approved proposition from 2004. The proposition was written to include feedback from the community. We encourage everyone's input. This video includes speakers who will give you an overview of the Mental Health Services Act and highlights from the Riverside County Plan. This video includes a link to the entire draft plan and to a toolkit of plan summary materials. You will also find a feedback form that can be completed and submitted electronically. For those wishing to provide verbal comments instead, this post also includes an MHSA feedback telephone voicemail number that allows you to leave recorded feedback. The Behavioral Health Commission will ensure that all stakeholders have an opportunity to be heard and all comments provided electronically or as voicemail messages will be recorded and become a part of the public record. The Behavioral Health Commission will review all the comments and recommend changes to the draft plan if necessary based on the comments received. Thank you for joining us today. Together, we can improve opportunities for a healthier, more resilient Riverside County. Please share this video with anyone you know who cares about mental health programs in Riverside County. Each of the following speakers will introduce themselves before they provide you with their overview. So thank you very much, be well, and stay safe.
Hi, my name is David Sholin, and I'm a clinical therapist and the Mental Health Services Act Administrator for Riverside County. My job is to ensure Riverside's compliance with the Mental Health Services Act, otherwise known as MHSA or MISA. The Mental Health Services Act was a ballot measure passed by California voters in November of 2004 that provided specific funding for public mental health services. The act imposed a 1% taxation on personal incomes exceeding $1 million, creating a dedicated funding stream for the public mental health service system across the state of California. Each county receives an allotted amount of funds, and each county develops its own MISA plan. In March of 2024, California voters approved a new proposition that updated MISA called the Behavioral Health Services Act. Though that law took effect this year, the first plan under that new act is not due until July of 2026. Until then, we follow the rules under MHSA. An important part of MHSA compliance is ensuring an active community participation process, where you can provide feedback on sustaining programs, developing programs, or changing programs in Riverside's MHSA plan. This video will serve as an introduction and orientation to the MISA plan. After you listen to the video, you can click on the links embedded with this post and read the draft plan, how to provide feedback, and to participate in a public hearing. You can also give verbal feedback by calling the MISA feedback voicemail using the phone number also posted with this video, or, as indicated, attend a regional in-person public hearing, which will be held this year at our very popular May is Mental Health Month events. Times and locations have also been added to this video. You can also learn more at the Riverside University Health System website at ruhealth.org. MISA is divided into 5 components, almost like chapters in a book. Each component addresses a different area of the public mental health service system, and each has its own rules and regulations. As we introduce each component to you, we will also give you some related plan highlights. First up is the Community Services and Supports component, or CSS for short. Community Services and Supports, or CSS for short, is the largest of the MHSA components and receives the most amount of money. It is designed to expand clinic programs and mental health recovery services. CSS establishes a high-intensity therapeutic case management program called Full Service Partnership, or FSP. FSPs are designed to address the needs of people who have had the greatest consequences due to untreated mental illness, such as school failure, unemployment, incarceration, repeated hospitalizations, or homelessness. Over 50% of CSS funding must go to FSP programs. The CSS component also includes our housing developments and homeless outreach programs, our regional mental health 24/7 urgent care centers, mobile crisis response teams, law enforcement and clinical therapist response teams, and the collaborative courts, which combine the authority of the court with a behavioral health treatment plan. Some CSS plan highlights this year include Riverside County has a comprehensive behavioral health crisis system of care. Our crisis system of care includes a 24/7 crisis support center that accepts phone calls from community members requesting urgent behavioral health support. People can call 951-686-HELP, and a dispatcher will connect the caller to the best response option. One option is the RUHS-BH Mobile Crisis Team, made up of clinical therapists, case managers, addiction counselors, and peer support specialists who can de-escalate the situation or provide alternatives to hospitalization or alternatives to law enforcement involvement. People who need immediate voluntary behavioral health care can also be referred to one of the 3 24/7 regional walk-in mental health urgent care clinics. These urgent care clinics are in the cities of Riverside, Paris, and Palm Springs. Research indicates that people in need sometimes refuse care because of stigma and a symptom called anosognosia. Anosognosia is a neurological condition in which the person is unaware of their psychiatric condition. This can prevent them from seeking help. Care Court can give families and concerned community members an additional choice. Community, Assistance, Recovery, and Empowerment Act, known as Care Court, launched in October of 2023. This collaborative court team serves consumers with schizophrenia spectrum disorders, who the court has ordered into supportive treatment. This program celebrated its first graduate in December of 2024, one of the first graduations in the state. As of January of 2025, over 400 people were referred and 116 became clients. To learn more about Care Court, go to ruhealth.org, choose Behavioral Health, then choose About Us from the menu, and then select Care Court. Or you can call our CARES line at 800-499-3008. Supporting and connecting people to behavioral health care is also a mission of our peer support programs. These programs are staffed with people who share the same lived experience as the people they are supporting. Family advocates of adults who have behavioral health needs, parents of minor children who have had children who had behavioral health needs and received care in our system, and consumer peers, people who carry a behavioral health diagnosis and have received care themselves. Experience brings insight, and these folks have been there. They use their insight and knowledge to help problem solve, educate, and validate, and most importantly, to give hope. If you'd like help as a family member of someone who has behavioral health symptoms, please call the Family Advocate at 800-330-4522. If you're the parent of a minor child with behavioral health needs, please contact Parent Support and Training at 888-358-3622. You can also find both of these programs at the department's website at ruhealth.org. Choose Behavioral Health, then pick the Consumer Peer Services button at the bottom right of the page. Now, to tell you more about the next MHSA component is Diana Gutierrez, the manager of the Prevention and Early Intervention component.
Hi, my name is Diana Gutierrez. I'm the Prevention and Early Intervention Manager with Riverside University Health System Behavioral Health. The intent of Prevention and Early Intervention, or PEI, is to engage people before the development of a serious behavioral health disorder. Riverside's PEI plan has 7 work plans or focused areas of need. Each work plan has several programs and services. RUHS primarily relies on community contractors to provide PEI services. This year's update includes just a few highlights from the overall PEI plan. Please see the full MHSA draft plan for more details. Work Plan 1 is Mental Health Outreach, Awareness, and Stigma Reduction, which includes strategies to reduce mental health stigma, provide mental health education, and increase access for underserved communities. The underserved communities in Riverside County are Hispanic Latinx, African American Black, Asian American Pacific Islander, Native American, Middle Eastern North African, LGBTQ+, deaf and hard of hearing, people with disabilities, faith-based or spirituality, and veterans. As part of the planning strategy to reach those underserved communities, PEI also funds some activities under our Cultural Competency Unit. Now we'll hear from the Cultural Competency Program for more information.
Thank you, Diana. My name is Misty Martin, and I'm the Senior Family Advocate with the Cultural Competency Program. Research indicates that culturally informed care works. The more people are reached and connected to needed care, the less likely they are to experience the consequences of untreated mental health needs, such as repeated hospitalizations, the use of expensive emergency services, incarceration, school failure, and homelessness. Service delivery would be easier if we were all exactly alike and had the same experiences, but meeting people where they are increases the likelihood of opening the door for healthier and more productive lives. Some folks do better when matched with a provider who shares or understands their worldview. This can be based on a shared perspective, like with religion or spirituality, or a shared experience like being a military veteran, or shared cultural history, such as being an ethnic minority. Some of the highlights from this year's Cultural Competency Plan include: we hired a full-time Veteran Services Liaison, or VSL. Our long-standing VSL resigned almost 2 years ago, leaving a vacancy that was difficult to recruit. The VSL is a therapist who not only provides therapeutic and case management services to Riverside County vets, but also promotes behavioral health awareness and stigma reduction to seeking care for our military veterans and their families. The incumbent holds a degree to provide psychotherapy and has their own lived experiences in the military. In August 2024, we refilled the position with a veteran Navy corpsman and have begun the process to rebuild the infrastructure of his role. We also improved crisis engagement for the deaf and hard of hearing community. In partnership with Hannah Interpreting Services, our program developed remote video American Sign Language interpretation for our 24/7 mobile crisis teams. This allows quality ASL interpretation at any time of day or night when dispatched to assist an ASL speaker in behavioral health crisis. We ensured the voices of our 10 identified communities were part of the MHSA plan development. Our cultural community liaisons, or CCLs, are people from the 10 communities who are contracted to reduce access barriers to behavioral health care. The CCL's activity provides community education, build care bridges, and make referrals to supports and services. They host their own community advisory committees, serve on the steering committee of this PEI plan, and on the steering committee for the MHSA Innovation Plan, serving people with eating disorders. We refined and standardized Cultural Competency Program evaluation protocols. Collaborating with the department's evaluation unit, we developed standardized data protocols to create consistent measurements of program outcomes. We measure audiences' responses to trainings and presentations, as well as the number of direct referrals our program makes to service providers. We sustained and developed a 10-month cross-county collaboration with San Bernardino County's Department of Behavioral Health. The collaboration focused on capacity building of Black-owned, community-based organizations to help fill the gaps in behavioral healthcare program options. This collaborative continues by looking at capacity building for Asia and Pacific Islander and LGBTQ communities. We look forward to partnering even more with community to ensure every Riversider has the opportunity to thrive and contribute to building Riverside County's future. I now return you to Diana for the rest of the PEI update.
As part of Work Plan 1, PEI sponsored or hosted several community outreach and engagement events that included May's Mental Health Month events were held in all 3 regions of Riverside County. These events provide behavioral health awareness and education. They featured free food, culturally diverse music, art, and activities to roughly 3,800 participating community members. Roughly 300 partner agencies across the county shared their services and resources to attendees. The Directing Change statewide program and film contest challenges youth to make brief public service announcements on related behavioral health topics. 203 films were submitted from 26 Riverside County schools and community-based organizations by 580 youth. Riverside County's Eleanor Roosevelt High School won first place in the suicide prevention category. The annual Dare to Be Aware Youth Conference expanded to include 2 events this year. The conference allows middle and high schoolers to dive deeper into issues affecting their wellness. Conferences were held in Riverside and Palm Springs. 23 schools countywide participated, and the events were attended by 500 youth and advisors. Some additional Work Plan 1 strategies include community mental health promoter programs. Promoters provide behavioral health education and focus on target populations, including Latina, Native American, Asian Pacific Islander, Middle Eastern, North African. Providers engaged almost 14,000 community members and delivered over 3,000 one-hour behavioral health presentations. Additionally, 91 trainings were offered through the PEI Administration Unit. Monthly trainings on a variety of behavioral health topics are held both virtually and in person for the general community at no cost. In total, for the fiscal year 23-24, over 1,500 participants attended. PEI, in partnership with the Suicide Prevention Coalition, has launched short-term grief counseling for survivors of suicide loss at no cost to residents of Riverside County. Loved ones of people who died by suicide are at increased risk themselves. This pilot offers 6 to 8 free sessions to suicide loss survivors through specially trained community-based clinicians. Suicide loss survivors can request this service by visiting the TIP website at www.tiprivco.org/bereavement counseling. Work Plan 2 is parent education and support, which includes services that assist parents and families in building protective factors and reducing risk for the development of mental health problems. The Strengthening Families program is an evidence-based program that emphasizes the importance of strong family relationships and building family resiliency. The program seeks to make family life less stressful and reduce risk factors. In fiscal year 23-24, the program served 117 families with 144 parents attending. Work Plan 4 is focused on transition-age youth, ages 16 to 25, at highest risk of self-harm. This includes targeted outreach for LGBTQ TAY in or transitioning out of the foster care system, runaway TAY, and TAY transitioning into college. Work Plan 4 includes Stress in Your Mood, an evidence-based early intervention program used to treat transition-age youth who are experiencing depression. In fiscal year 23-24, the program served 244 participants. Outcomes demonstrated a statistically significant reduction in depressive symptoms. Work Plan 5 is first onset for older adults and includes services to reduce first onset of depression in the older adult population. The programs within this work plan include cognitive behavioral therapy for late life depression, or CBT-LLD, program to encourage active, rewarding lives for seniors, or PEARLS, and a partnership with the Riverside County Office on Aging. These programs served 403 participants with overall reductions in depression and anxiety, along with improved quality of life. Work Plan 6 is trauma-exposed services, providing services to reduce the negative impact of trauma. This work plan includes cognitive behavioral intervention for trauma in schools, or CBITS, a school-based group intervention for grades 5 through 12 that has been shown to reduce post-traumatic stress disorder and depression symptoms in children who've experienced trauma. CBIT served 313 youth, 64% of youth had their trauma symptoms drop below the clinical significance. Work Plan 7 is underserved cultural populations. This work plan includes programming for underserved ethnic populations within Riverside County. The program includes evidence-based practices that are effective with the populations identified. Building Resilience in African American Families project, also known as BRAF, utilized a multi-intervention strategy with the primary program goals of reducing behavioral health risks and increasing resiliency for at-risk African American families. This program faced many implementation challenges over the years, including program recruitment and retention. After providing additional strategic supports, trainings, and technical assistance, it was determined that this program was no longer meeting the needs of Riverside's African American community. African American community stakeholders recommended that the county needed a more thorough understanding of their community, and as a result, we are in the competitive bid process to select a culturally specialized research agency that can conduct a comprehensive community needs assessment. Findings will inform program development options for Riverside's African American community. Mothers and Babies, or the Mamas y Bebés program, is designed to reduce risk and symptoms of postpartum depression for underserved cultural populations. For fiscal year 23-24, the program served 255 women, 83% of whom were Latina and 3.5% were African American. Overall outcomes showed statistically significant reduction in depressive symptoms. Program providers are working to increase engagement with the African American women throughout Riverside County by partnering with other African American serving organizations and work groups. If you have questions or want more information about prevention and early intervention, please email us at pei@ruhealth.org. Thank you.
Thank you, Diana. Hello, my name is Leah Newell. I am the MISA Innovation Lead. The innovation component of the Mental Health Services Act is designed to advance knowledge in the field of public behavioral health. These are time-limited research projects and require an additional approval process to access funds from the state. By targeting an identified need within the county, innovation projects provide an opportunity to implement, evaluate, and modify a service strategy, thereby providing new knowledge to inform current and future mental health practices. Our 5-year innovation plan, Help at Hand, expired in February of 2024. The Help at Hand Innovation Plan explored the best ways to bring technology-based mental health tools into the public mental health service system and was a resounding success. Many of the successful projects have been transitioned into our standard system of care. Riverside County implemented 9 Help at Hand projects that continue to serve the community. These projects are the Help at Hand Live Peer Chat, which is now under RUHS-BH Peer Support Services and continues to provide free peer-to-peer live chat interface using real-time conversations for individuals 16 or older seeking non-crisis emotional support. It remains available online at takemyhand.co or tomamimano.co for Spanish speakers and via iPhone and Android apps. The App for Independence, or A4I, is a mobile app used to support the recovery process of individuals living with schizophrenia or psychosis. A4I is now also managed under Peer Support Services. Digital mental health literacy training activities will also continue under Peer Support Services with the goal of breaking barriers in the utilization of digital mental health tools among the individuals we serve. The Whole Person Health Score is a simple screening tool that can help a person and their healthcare team determine areas of health strength and risk across 6 domains: physical health, emotional health, resource utilization, social economics, ownership, and nutrition and lifestyle. Our Help at Hand partners validated the tool and digitized it for virtual platforms, ensuring a reliable measure that is easily accessible by the community and their healthcare providers. Man Therapy, a mental health engagement campaign geared specifically for men, and La Clave, a mental health awareness education program created to help individuals and their families recognize the symptoms of serious mental illness, were both well embraced by the community. These programs have continued as part of the Prevention and Early Intervention Plan. Man Therapy now also has an active Spanish website option that went live in February 2024. The 90-plus interactive kiosks that provided a wide range of information on healthcare access were installed in waiting areas throughout Riverside County. These kiosks remain active as points of service navigation and education for people seeking care. And lastly, piloted as part of the Help at Hand Innovation Project was the Recovery Record app. The app is used to assist with eating disorder management and will continue to be utilized as part of the new Eating Disorder Innovation Project. Information on the Help at Hand project can be accessed at the helpathand.info website. As Help at Hand ended, a new plan began. Over the past year, we have actively shaped a new Riverside County Innovation Plan, an eating disorder intensive outpatient and training program entitled the Mindful Body and Recovery Program. This 5-year, $29 million plan was approved by the state in February 2024. Designed to address the challenges of treating eating disorders, this project will create an eating disorder hub where we can examine how to best treat, train, and educate our Riverside County community through an integrated care approach. Eating disorders have the second highest mortality rate of all mental health disorders, with one person dying from an eating disorder every 52 minutes. The project goals are to improve treatment practices and outcomes, increase access for underserved populations, and raise community awareness and understanding of eating disorders. This project aims to train practitioners while increasing access to high-quality eating disorder services for our members, thereby providing a level of care previously non-existent in public behavioral health. The Intensive Outpatient Program, or IOP, will serve adolescents ages 12 to 18 years old who require this higher level of care. Targeted education and outreach will also help facilitate early diagnosis and intervention. Early implementation of the project started in August of 2024. Since then, the Mindful Body and Recovery Program has hired, trained, and onboarded staff, developed its strategic plan, and began establishing its program operational infrastructure. Our next steps will include opening our doors to members, creating, collecting, and distributing informational materials, and working with plan partners to educate the community. The Mindful Body and Recovery Project, currently housed at the Paris Valley Community Health Center, is slated to relocate by the end of 2026 to the Capital Facilities Project, the Mead Valley Wellness Village. Next up is Nisha Elliott to tell you about the Workforce Education and Training component.
The Workforce Education and Training WET component of the Mental Health Services Act was established to address the ongoing workforce development needs of the public behavioral health care system. The authors of MISA realized that even the best MISA programs are just words on paper without a caring and committed workforce to implement them. Our mission is to promote the recruitment, retention, and training of qualified staff at all levels and operations of the department. We value a diverse workforce that reflects the membership of our unique communities, and we value reducing related service disparities. To achieve our mission, WET filters our vision through the lens of the 5 established work plans or areas of focus in the WET plan: workforce staffing support, training and technical assistance, career pathways and internships and residencies, and financial incentives. Today, I will share some of the highlights from the last year. One of the important things is training. Not only develops a qualified workforce, but is also key to staff retention. WET offers department-wide training for our employees, for our contracted providers, and for community collaborations, such as the Transforming Our Partnership for Student Success, or TOPS program with the Hemet Unified School District. The TOPS team received training by WET's teaching clinic, the Lehman Center. WET offered 158 trainings for our greater department team, an increase from the 98 trainings delivered the previous year. Collectively, those trainings provided 468 continuing education CE units, and for over 3,000 attendees. Trainings included cognitive behavioral therapy for PTSD, dialectical behavioral therapy, suicide management, and seeking safety, culturally specific training, and gender-affirming care to better serve our LGBTQ community. In addition, the Lehman Center WET's teaching clinic offered competency trainings for clinical supervisors. There is an ongoing and growing need for more licensed clinicians to meet service delivery goals. WET continues to offer the Clinical Licensure Advancement and Support, or CLAS programs, which supports the development of journey-level therapists to prepare for their licensing exam. Last year, 24 participants passed their licensing exams and promoted into Clinical Therapist 2 job classifications. This is an increase from the 16 participants who passed the prior year. Making sure that our journey-level therapists have the supports they need was previously up to each department program. Clinical supervision is the legal requirement, mentoring, and oversight that new therapists need to meet board licensing regulations. WET received approval on a proposal to centralize this support to ensure consistency with legal and ethical responsibilities and regulations and standards. This program is called Clinical Supervision Resources and Support, or CSRS, and it was implemented in the last quarter of 2024. Clinical therapists from MISA and WET administration, as well as through the Lehman Center, provide supplementary clinical supervision for our department programs. Both individual and group supervision are offered to clinics that do not otherwise have the clinic supervisors necessary to meet the needs of the newly hired therapist. WET also acquired nearly a $500,000 grant from Kaiser Permanente to offset the salary of department staff, to support in expanding the diversified and the clinical workforce, and to provide a pathway for unlicensed staff to achieve licensure. WET is also focused on recruitment. We are invested in growing the future staff of public behavioral health and have established pipeline partnerships with high schools and colleges. We collaborate with partnerships such as Norco College, Val Verde Unified School District, Vista Del Lago High School, and Moreno Valley College to inspire and support the next generation of practitioners. Due to the growing need of resources in our desert region, WET added a partnership with One Future Coachella, opening the door for WET to expand the department's relationship with College of the Desert and CSUSB, Palm Desert Campus. Pipeline outreach increased, reaching approximately 2,205 students and community members. Another avenue in building future staff is through our department's internship program. WET continues to have one of the largest behavioral health internship programs in the Inland Empire. WET received over 120 applicants and accepted 37 master's or bachelor students from 10 different universities. 42% of the students were multilingual, with over 50% being Spanish speakers. Interns include employees from our 2020 program. This is an incentive program from our paraprofessional staff to return to school to earn a master's degree in the behavioral sciences that prepares them to be the therapist in the department. Lastly, when it comes to workforce development, national research indicates that public mental health systems experience frequent staff turnover, especially within the first 2 years of hiring. Financial incentives, such as loan repayment programs, are successful incentives to retain much-needed professional staff. WET coordinated textbook and tuition reimbursement for 29 staff that were approved and awarded over $84,000 to advance knowledge or earn a certificate or degree. 7 more department clinics were approved as National Health Service Corps sites, permitting eligible staff to receive up to $50,000 in federal student loan repayment in exchange for a service commitment. We're excited to do the work that we do. Thank you for giving me some of your time today. Meeting the countless needs of our department clients and their families is often taken for granted. Please remember to let your therapists, counselors, specialists, psychiatrists, nurses, or peers, and the great support teams around them know how much you appreciate them. Be well.
Thank you, Nisha. The final component is Capital Facilities and Technology, or CFTN for short. This component funds new buildings or information technology to support the infrastructure of service delivery. Current CFTN projects include the Franklin Residential Care renovation. Franklin Residential Care is an 84-bed adult residential facility that will provide short-term recuperative care and outpatient behavioral health services. The renovation supports RUHS-BH's mission to bridge the gap between acute psychiatric care and long-term community-based housing solutions. Franklin Residential Care will serve as a critical transitional facility for individuals requiring a structured support before moving forward to independent living. Franklin Residential Care Facility includes all the amenities of a licensed residential care facility, such as meals, medication management, and personal care assistance. In addition, the facility will have an on-site outpatient behavioral health clinic that will be accessible to both residents and community members. The department remains committed to innovative, person-centered solutions that foster long-term independence and community reintegration. The Franklin Residential Care renovation is a testament to that vision, ensuring Riverside County residents receive the care and support they need at a critical stage in each of their recovery journeys. The Franklin Residential Care Facility is now opened and is accepting clients. Another CFTN highlight is the Mead Valley Wellness Village. The Mead Valley Wellness Village represents a significant MISA Capital Facilities investment in Riverside County, aimed at closing critical gaps in behavioral health, substance use disorders, and integrated medical services. Historically, many residents, particularly children, have had limited access to timely, coordinated mental health care, which often required lengthy travel or out-of-county referrals in order to respond. Riverside University Health System is creating an 18-acre campus that centralizes essential health and support services. Guided by a behavioral health continuum of care model, the village will integrate and coordinate behavioral health, primary care, substance use treatment, and social supports on one campus, ensuring that patients receive seamless wraparound services without having to navigate multiple providers across large distances. Construction broke ground in 2024 and continues, including site grading, foundation work, and initial framing, all keeping us on deadline for December of 2026. And that concludes our presentation. If you'd like to get more involved, please request a community participation directory, which lists the times and locations of local community advisory meetings by contacting mhsa@ruhealth.org. Thank you for participating in this year's Riverside County Mental Health Services Act annual update. Don't forget to click on the link below for more information, to complete an online feedback form about the plan, or to use the MISA Plan feedback telephone line if you prefer to leave a recorded feedback instead. Be well.